Hi, everybody. This is Dr. Nam Lee from Lee Acupuncture. I have a special guest, Dr. Terence Lee. Hi, Doc. How are you?
Hi, Dr. Lee.
Yeah.
I don't think we're related. Well, I don't think we're related closely, but maybe 50 generations back we might be. But thank you for inviting me.
Thank you for being here, Doc. I know your time is at a prime, like a premium, so I'm gonna go ahead quickly. Let me explain who Dr. Terence Lee is. Dr. Lee completed a fellowship in reproductive endocrinology and infertility at the UCLA and Cedars-Sinai Medical Center. After graduation, he initially joined a large group practice for a year before leaving to build a practice on his own. So fertility care of Orange County has been continuously open since 1997 and has helped in the conception of over 2,800 healthy babies. In addition to leading this medical practice, Dr. Lee is a primary lecturer on infertility to the medical students at the UC Irvine College of Medicine, where he has taught over 2,000 students throughout the years. So he has received the teaching awards and then excellent student ratings and remained fully active in his teaching. Dr. Lee is the one of initial founding members of Ovation Fertility, a multi-center embryology network and think tank. Wow, Doc, amazing. So can you tell us about your practice briefly?
So I've been in practice since, I think, 1997. And there are many good fertility practices in Southern California. Something that we're different about is we're more of a family-owned business. So a lot of the big practices now are large corporate entities. So my staff and I, we are like family, and we just make a team that has a lot of fun, and we have good morale, and I love my team, and that's one of the things that makes us different. So we don't have the capability to do 1,000 cycles a year or anything like that, but we're not trying to do the most. We're just trying to do what is the right thing for our patients and get them good results and have them have a good experience.
That's the most thing. I mean, we want result and then that connection with your practice. So what made you decide to focus on fertility, Doc?
Well, it's interesting. I think a lot of our paths in life are not predetermined, the way that we think. So I originally went into OBGYN, and I was going to go into a different field of OBGYN, namely oncology, because my mentor was the chairman of the department and he really guided me. But then I changed my mind and I wanted to do infertility. So I was almost a little timid to ask him if he would be mad. But then he was so supportive, and then he, helped guide me and got me into UCLA, and then the rest is, the story. The rest of the story is history. Yeah. So it wasn't really my my thought when I first entered residency, but I quickly fell in love with the field mainly because it's a lot happier than, when you take care of very sick patients, you're helping them go from a very sad situation back to the status quo. And then infertility, you can think of it as taking them from the status quo into a super happy situation. So
drastic difference, oncology to infertility. We love to have you in this field, though. You're amazing. So through your experience seeing this so many patients over the years, so what have you seen the biggest struggle, like many people experience with the fertility?
Well, fertility definitely has aspects of just, medical situations. It also has aspects of very emotional situations. So sometimes, as you know, when we do our thing, we're using science and technology to help patients. Many times we also have to act like life coaches, marriage counselors, because a lot of our success, it's not just how the embryology lab does a good job with the embryos, it's also how the patient lives their life. So if we can get them motivated to change what they eat, to exercise more regularly, to keep stress under control, to get good quality sleep. As you know, chronic sleep deprivation is one of the most hidden harms to people's health and to their fertility. So sometimes bridging the gap between telling them what to do and then actually have, you can tell any patient that they should eat healthier, but the challenge is to turn that desire into a reality. And so there are many strategies and tricks associated with that. And one thing to remember is that every patient is different. Some patients, you tell them how to eat and they'll just obey it and follow it. And others, you have to help them come up with tricks to stick to it,
True. That's why I think the doctor is also the coach as well. So to make them easier path. Absolutely. So what are the biggest myths about the fertility? Is there any myths people have?
Well, nowadays with the internet, every patient that comes to me, they have already done a lot of homework. So they have already, same with you, right? So they have looked on the internet, and there are many things that are true out there, but there are also a few things that are not true. So I always stay open-minded that, if patients tell me that they're doing a lot of research on the internet, I welcome it. I would just like a chance to discuss it with them and help share my opinion on certain of their beliefs to give them evidence on whether it's true or not. So there are a lot of myths about, there's a lot of commercially sold items, so a lot of people will buy certain supplements just from the internet before they come to see us. And who's to say, maybe some of them are successful, but obviously the ones that eventually come see us, they're not successful. They may have tried something they bought on Amazon or something they bought at the nutrition store. And if they got pregnant, then they wouldn't be seeing us. But the ones that continue to stay infertile, they will come see us. So that's probably one of the bigger myths is, that there is some magic supplement that's going to get everybody pregnant. There obviously is not.
Exactly. Not helping sometimes is harmful as well. I agree.
That's actually true. You're right. I agree.
Absolutely. So what is the mistakes people make comes to fertility?
Well, sometimes, waiting too long is a problem. And so it's confusing because in some cases, patients should not be too aggressive. And in some cases, they should not be too under-aggressive. So it's important that whatever a patient decides as their strategy, they should always set a deadline. So let's say somebody's been trying for 3 months and they go see their doctor and they get, a basic workup and everything turns out okay. Well, that's fine. Then they don't necessarily need fertility treatment, but they should set a deadline. So they may just circle on their calendar that 6 months from now, if I'm still not pregnant, then we're going to take action. Otherwise, without doing that, they may just get lost with life. And then one day they wake up and it's 5 years later and they wonder, what happened. So if a couple is going to try on their own, probably maximum of 1 year before taking action. Yeah. And some patients, older patients should have a much shorter cutoff.
6 months.
But always have a plan, always have a next step, always have a deadline.
Thank you. Thank you for reminding us. So this comes down always like a burning question, male factor. I think it's not only female factor, there's so many male factor in infertility. So if a patient goes to you for IVF, then, okay, we need just only one good sperm. So it means men doesn't need to do anything at the IVF protocol to improve their male factor?
First of all, right, good question. First of all, we don't start with IVF right away. We are always going to try to exhaust any reasonable possibility of getting pregnant using simpler, less invasive, less expensive methods. So for, when you're in the IUI stage or the trying on your own stage, sperm is very, very important. And I always do involve the husband's health as well. Sometimes it's really awesome that if we have the wife change her way of eating, and also the husband does it, they really support each other. And they, one of the protocols I have involves always having a big cheat day on Sunday. So it's great when the husband and wife work so hard to stay disciplined Monday through Saturday, and all week long they can fantasize about where they're going to go eat on their cheat day. So definitely involving both partners together in the lifestyle habits of, exercise. For example, if they're going to do a 1-minute sprint every day, they can race each other and keep each other accountable. So I think that if they go to IVF, yes, it's true that the impact of the sperm is a little less important because we are using technology just to really, really improve the function of the sperm. But of course, it still is a good idea to lead a good, healthy, optimal life. And because for two reasons. One is that any improvement still will help the IVF better, but also it's just good to be healthy and energetic, especially if you're going to be a dad and take care of kids, right?
It's not easy to have kids. Yeah. And I think what this woman wants is a support from husband as well. So that's what a lot of it comes out as a question in our clinic. So sure. How you utilize like a holistic approach like acupuncture in your practice?
So when a patient comes to us, again, we have drugs and technology, but the holistic part is very important. So I focus on 6 factors. One is diet, exercise, stress control, quality of sleep, minimizing or avoiding bad habits, and then of course, to some degree, supplements as well. So where acupuncture comes in for me is more along the lines. So I understand this is my opinion, is that acupuncture plays a role in just the overall well-being of the patient. I don't necessarily see a lot of evidence that there's something specifically unique that makes acupuncture like the only way to achieve it. So some patients, maybe they will learn to relax through meditation, maybe get massages. One patient had great success doing flotation tank therapy, and so again, this is my opinion. So if a patient is really enjoying acupuncture, and most of them do, then I strongly advocate that they do that. Now, you probably have run into some patients that they go do acupuncture, but for some reason, maybe not in your practice, but in other practice, they just hate it. Like they don't like the needles and it's just a stressful experience for them. So I feel comfortable saying that it's not for everybody. So it's for many people, they enjoy it and that's what it should be. But if they don't like it, well, then we'll find some other solution, maybe get massage instead.
Absolutely agree. Absolutely. Because you say your 6 factor, there's just stress and sleep. Definitely acupuncture can help, but some people have needle phobia. They can have other stuff. There's just so many different things. So I think I love your honesty, doctor.
And they all those things are interrelated. If someone starts eating better, they suddenly have more energy to exercise and they sleep better and they feel more relaxed and less stressed, right? And then the same thing goes. If they exercise more, they also I don't know if I said that right. Like if you improve in any area, it will also just improve the other areas, and that just leads to better well-being.
Absolutely. So thank you so much again. So what can be done to help to figure this out, and then how people can find your practice, Doc?
To figure what out?
Oh, this fertility journey. Maybe go see you first, or what they have to do first.
So as I said, there are a lot of good practices in Southern California, and we have a capacity of doing the things the way that we do it. So we are not able to accommodate 1,000 cycles or even 500 cycles per year. So one thing maybe they can do is like go to our website, which is ocpregnancy.com, and most of our website is more informational regarding my views on each of the topics, such as recurrent miscarriage or polycystic ovary syndrome or infertility in general. Then when they are ready to make a decision, they can either just make an appointment, or I give them an option of just talking to me, no charge, over the phone for maybe 10, 15 minutes, just to see if they are a good fit, a good candidate for our practice, and if we are a good fit, good candidate for them. So we're not looking to be the busiest practice, just the happiest.
Happiest and the quality we're talking about. Thank you so much for your valuable time. That I know you are extremely busy, and the audience and student, I mean our patient will definitely appreciate your just great ideas, and hope you have a wonderful holiday, and then we can see you very soon. Thank you, Doc.
It was my pleasure, and continue to keep doing what you do. Okay, take care.